Mark Rabin, and welcome to episode 159 of Lean Blog Audio. This is a post from November 17th, 2016, titled, "In My Global Lean Healthcare Travels, These 21 Things Are Pretty Universal." Now, I do a lot of work across the United States, but I've also been very fortunate to work with hospitals, clinics, and health systems around the world over the past 11 years. It started with a few trips to Canada to conduct some hospital lab assessments and lean leadership training when I worked for a J&hospital consulting group. Well, then came an opportunity to spend about 8 weeks working with a hospital north of London in 2008. It was a fascinating opportunity. And in recent years, I've visited or coached hospitals in the Netherlands, Sweden, Finland, Japan, China, and now Thailand. Now, these are, of course, very different countries in their national cultures, and their high-level big-picture health systems are designed differently, including the level of universal coverage or lack thereof, and who pays, things like that. But when you look at the details of how the work is done, how healthcare is delivered, how people manage, things are really more the same than they are different. In England, they said, and I won't try to do the accent, same problems, different accent. The same has been true in my most recent stop in Thailand, except it's same problems, different language. So what's pretty universal about healthcare in different countries? These are generalizations, but they're generally true. People working in healthcare are well trained in their specialty or function, and they're very smart. They're in their line of work for reasons other than just money. They're very passionate about patient care. But their training and knowledge of the work is very siloed. Nobody understands the big picture and the way the system works. What do the upstream and downstream functions and departments do? An analogy would be an American football quarterback knowing how to throw a perfect spiral, but not knowing how to play football on a team. There's usually very poor teamwork and coordination across departments, and this isn't the fault of individuals, it's the way the system is structured. People often say they're too busy to improve, and sometimes they say they're too busy to learn or to read a book. Some people will readily admit that there are problems or opportunities for improvement, and some will say quite literally, "We have no problems here." Now, sometimes people are unaware of problems and opportunities, and sometimes they don't want to admit that they exist. And again, this might not be their fault as individuals either. People aren't taught how to study work. They're not taught how to observe flow and observe work, how to map processes, yet alone value streams. And again, this isn't their fault. Healthcare professionals aren't taught the basics of operations management, queuing theory, inventory management, or other helpful disciplines. They haven't been taught much about scheduling approaches, and they think that trying to run at 100% utilization is a good idea. And I've, as an aside, I've blogged about how that's troublesome. You can find a link if you go to leanblog.org/audio159. But this lack of learning of operations management, it's not their fault. Highly educated professionals in healthcare aren't taught how to train others in their professional skills using effective proven methods like the training within industry approach. People generally aren't taught how to lead or how to manage. They're expected to figure it out. Some people dedicate themselves to the craft of management, and they do figure it out, but many don't. Leaders aren't being coached or mentored in how to lead effectively. Now, even though there might be statements of mission, vision, and values posted on the wall, it doesn't mean the culture really lines up with that on a daily basis. Now, one common problem statement in all these countries is that patients are waiting too long in all of the different ways and places they could wait. That's not the fault of individuals. It's not people being lazy or uncaring. It's a matter of system design. Flow problems are not caused by lack of effort. It's usually due to batching, silos, and a lack of coordination across value streams. And, again, did I mention that people are really smart and caring and hardworking? Hospitals always have trouble finding wheelchairs and getting patients transported, but these are fixable problems. People often think, the way it's always been or is the way it has to be, and that's not their fault either. Now, people will participate in root cause analysis. These problem-solving methods work just as well in different settings in different countries. When you give healthcare professionals time, even just a few days, to study their work and the system, to discover the current state as a team, they make amazing discoveries and gain a lot of insights. They've generally never had time to do that, and again, that's not their fault. When taught some basic lean methods and mindsets, it can really light a spark in people. It shows them that improvement is possible and things don't have to be the way they are. Things can get better. So in summary, these are not, if you will, American healthcare challenges. They are, it seems, just healthcare challenges. Now, yes, there are cultural differences in various countries, such as the extent to which people defer to those who are older or who have more seniority. But even with that variation, things seem more similar than they are different. Now, while some things are fairly universal and expected and maybe unsurprising, some things are surprising. Like a random Elvis impersonator I saw performing the other night in a hotel bar in Bangkok, my last night before flying home. And there's a picture, again, if you go to leanblog.org/audio159. The Thai people I was working with and at the hotel and other places were incredibly welcoming and wonderful. As much as one can generalize, they were welcoming, kind, lovely people. I'm honored that my book, Lean Hospitals, was translated into Thai, and you can see a preview of what that looks like through a link to Google Books that I put in the post. Again, leanblog.org/audio159. I'm thrilled and honored that some people there in Thailand are reading the book and really earnestly trying to use the concepts there.